Do you qualify for a Mutual of Omaha Medicare Supplement Plan? Stay tuned, and I'm going to go over all of the medical qualifications to go to a Mutual of Omaha Medicare Supplement Plan. Switching your Medicare Supplement Plan has never been easier. It takes about 15 minutes, and you can do it right over the phone. There's no need to have anyone come to your home and invade your privacy when you can talk to a licensed agent in my office, and we can help you save money on your Medicare Supplement Plan. If you are not new to Medicare, though, you do have to answer health questions to see if you qualify. Now, you do not have to get a physical or have anyone do any lab work or anything like that, but you do have to answer some health questions, and then you have to do an underwriter interview. And in this video, we're going to take a look at what Mutual Omaha will ask you to see if you qualify for their Medicare Supplement Plan. But again, if you're new to Medicare, you do not have to answer these questions. It's only if you have already been on Medicare for longer than 6 months and you want to switch your plan to a new one, here's what Mutual Omaha is going to ask you. So this is their application, and if I scroll down, I'm going to get to their health questions. So let's take a look at what their health questions are. Okay. Are you currently confined to a wheelchair or motorized mobility device? If you answer yes to any of these questions, you're not able to switch your supplement plan. Are you currently hospitalized, confined to a bed in a nursing or an assisted living facility? Have you been medically diagnosed with, treated for, or had surgery for any of the following? Chronic kidney disease, kidney failure, or kidney disease requiring dialysis, emphysema, chronic obstructive pulmonary disease, COPD, or any other chronic pulmonary disorder requiring oxygen, Alzheimer's, dementia, or any other cognitive brain disorder, Parkinson's disease, Huntington's disease, Lou Gehrig's disease, systemic lupus, myasthenia gravis, chronic hepatitis, or cirrhosis. So any of those conditions will stop you from qualifying to switch. Have you had an organ or stem cell transplant or been advised to have an organ or stem cell transplant, excluding cornea implants? So if you've had cataract surgery, that's okay. Do you have osteoporosis and as a result experience fractures? So a lot of times people get confused about this question because there's a lot of people, particularly women, that have osteoporosis. Osteoporosis alone will not stop you from changing your supplement plan to qualify. It's if you've had fractures as a result of having osteoporosis. So it's okay if you have osteoporosis as long as you haven't broken any bones because of it. And then do you have an implanted cardiac defibrillator? So if you answer yes to any of those questions, you can't switch to Mutual of Omaha. Now let's take a look at the next section. And this is going to ask, to the best of your knowledge and belief, most of these questions have to do in the last 2 years. Within the last 2 years, have you been treated for or been advised by a physician to have treatment for coronary artery disease, angina, heart attack, cardiac angioplasty, bypass surgery, or stent placement? So again, basically 16A and B is asking about any heart attacks or heart issues. Now, it's okay if you had any of these issues, say 6 years ago or 5 years ago or 10 years ago. That will not stop you from necessarily qualifying to switch. It's have you had it in the last 2 years? Okay, what most carriers and what Mutual Omaha wants is if you've had some heart issues or some other type of issues, they want a 2-year stability on that before they'll accept you into their plan. Also in the last 2 years, have you been treated for alcoholism or drug abuse? Any mental or nervous disorder requiring treatment, including hospital confinement? Internal cancers, lymphoma, or melanoma, a stroke or transient ischemic attack, TIA. So again, if you had a stroke, that doesn't stop you from switching to Mutual of Omaha. It's have you had a stroke in the last 2 years? Question 17 is do you have diabetes with high blood pressure and have you taken more than 2 medications for either condition, insulin dependent or oral medications, had any changes in your medications within the past 2 years? So let's talk about diabetes and how Mutual Omaha addresses diabetes. I will share with you, Mutual Omaha is kind of the standard when it comes to how they treat diabetes. There are some carriers that are a little more lenient, but here's what they're looking for with diabetes. They want a 2-year stability of diabetes in combination with any type of heart issue like blood pressure. So if you or a heart attack or anything like that. If you had blood pressure and you have diabetes, that's okay, but what they're looking for is what I call the 2-2-2 rule. You have to be on no more than 2 diabetic meds, no more than 2 blood pressure meds, and they have to be stable for the last 2 years. So as long as you are diabetic with a combination of high blood pressure, then they want it stable for 2 years. Now, if you don't have high blood pressure, but you just became a diabetic 6 months ago, that might be okay. If you're not diabetic and you just started a blood pressure pill a month ago, that's okay. The 222 rule really only applies in combination when you're diabetic and have high blood pressure. I will share with you what's not on these health questions, but what I've seen in my experience with submitting applications in Mutual of Omaha is if you are a diabetic and you've had any serious heart issues, like a heart attack or stent replacement or anything like that, they're probably not going to accept you, okay? Because if you're diabetic in combination with that, even if the heart attack was over 5 years ago, they typically will not accept you, at least what I've seen in my experience, submitting over thousands and thousands of applications with them. So if you are diabetic, you just got to watch in combination with any heart issues. Okay, the next one is, have you been hospital confined 3 or more times in the last 2 years for the same or similar condition? So what they're asking is, have you been to the hospital for the same condition or similar condition more than 3 times for the last 2 years? So if you went to the hospital because you had low blood sugar, and then you went to the hospital 6 months later because you fell and broke your leg or something like that, that's okay. What they just want to make sure that there's not an underlying condition that's driving you to the hospital that we haven't figured out yet. So that's a pretty common question. And this is a big one. Have you been advised by a medical professional to have treatment, further diagnostic evaluation, diagnostic testing, follow-up visits, or any surgery that has not been performed? So this is to prevent people that don't have a Medicare Supplement plan from not having one and then trying to jump on Mutual Omaha's plan to get them to pay for a claim that's coming up. It's similar to if you live in, let's say, Florida, and there's a hurricane that's coming to your area, and now all of a sudden you're trying to upgrade or get better homeowners insurance. When there's a hurricane in the Gulf of Mexico, the insurance companies are not going to increase your homeowners insurance until after that hurricane goes away. So it's similar here. If you know you have cataract surgery, or you know you have physical therapy coming up, or you know you have a stent placement or anything that's coming up, Mutual of Omaha is not going to accept you because normally a supplement costs about $100, $120 a month. So they would not it just wouldn't work if they let people wait till they need it to jump on the plan. It's like, let's say someone doesn't have car insurance, they get in a car accident and they're picking up their phone trying to get car insurance. They're not going to accept you. It's the same thing here. So if you know you have something coming up, you can't then jump on Mutual Omaha's Medicare Supplement plan. All right, now they're also going to ask you for a list of your prescriptions that you've taken over the last 2 years. Most of the insurance companies use a system called GenRE, which means they're going to ask you for their medications, but they're not just going to take your word for it. They're also going to pull all the data from the pharmacies that they have through GenRE to get your medications. So it's always good to, if you've ever taken any medication, to put that on there over the last 2 years, and so that you can at least tell Mutual Omaha that you're taking it and what you're taking it for. Now, I'm not an underwriter for Mutual of Omaha, and the only way to really know if you're going to be accepted is to apply. What's nice about working with my company is we have submitted literally over 45, 50,000 applications with over 30 different Medicare Supplement carriers, Mutual Omaha included. So our goal, no one ever likes to waste time and apply for a plan they're not going to get approved for. So we train our agents to be well-versed in all the underwriting guidelines, even the stuff that's not necessarily asked on these questions. So that way we don't waste your time, and so we can problem solve for you. Because let's say you call us and let's say you have a plan F with another good carrier, but Mutual Omaha happens to be able to save you money with a plan F, G, or N. Well, we can go to Mutual Omaha and let's say you answer yes to one of their health questions. One that comes to mind is, let's say, yes, I have COPD, but I'm not taking oxygen. Well, Mutual Omaha, in our experience, will not accept COPD. However, there are other carriers that do accept COPD as long as you're not taking oxygen to treat it. So it's nice to work with a broker like us because, one, we cost you nothing. There's no fee to you for our services. And two, we don't just have a hammer and a toolbox. We have a whole box full of tools, meaning we have tons of different carriers that might be more lenient on one item over the other. For example, we talked about Mutual of Omaha, where you have to have the 222 rule when it comes to diabetes in combination with blood pressure. Well, we have other carriers that allow you to be on 3 diabetic meds and 3 blood pressure meds. We have other carriers that don't have the stability requirement of 2 years. So it's really important to work with a broker when you're looking to get the right Medicare Supplement plan so that we can help you problem solve and find the right carrier that's going to accept you. Nobody likes being turned down, and it's also a waste of time for the carrier, and it's a waste of time for you. What's nice about working with us is the carriers like working with us because we don't just submit a bunch of business that's not going to get approved. It's our job to be the front line to protect the carrier from submitting a bunch of applications that aren't going to get approved. And what that does is that helps them save money because they don't have to, pay a bunch of people just to deny applications. If you would like our help with applying for Mutual Omaha or any other Medicare Supplement plan, I'll drop a link down in this video, and you can click a Get Quote, go to our website, learn a little bit more about us. Also, you can request a quote, and we'll help you get the most cost-effective Medicare Supplement plan that you are eligible for.